Hi, professor and classmates. Everybody has to bear with me. I've been suffering from a cold after I got back from a trip, so my throat kind of hurts. But let's get started. I decided to write on the impact of drug use during pregnancy. The use of drugs while a woman is pregnant can have a great impact. It can detrimentally affect her pregnancy. The consumption of drugs, to include tobacco products and alcohol, can lead to a lifetime of problems for the unborn baby. It can also lead into their adulthood forever. It's a sad reality of the world that people use drugs, period. It's even sadder when they decide to do it while they're pregnant. Studies show that the use of illegal and even legal drugs during pregnancy has a direct impact on the fetus. Women need to keep in mind that anything that they consume goes into their unborn child as well. If they're smoking, drinking, the baby is smoking and drinking. Same thing for consuming caffeine. It's another thing that's addictive that people say is a drug. Taking drugs during pregnancy increases the chance of birth defects, premature babies, underweight babies, and stillborn births. Many people may argue that smoking marijuana is okay. They think it's just a normal drug, that it's not going to do anything. But there are studies that have shown that marijuana can cause problems. It causes developmental problems. As well as the consumption of alcohol before birth can cause behavioral problems in early childhood. These drugs affect the child's memory and attentiveness. A lot of mothers who give birth to babies while they were on drugs, their babies get called drug babies and crack babies. It's been a common thing for many, many years now. Pregnant women really need to consider and think twice before they consume something harmful, because it's something that they're going to end up regretting for the rest of their life if something is wrong with their child. The use of illegal drugs during pregnancy can result in miscarriage, low birth weight, premature labor, placental abruption, fatal death, and even maternal death. Not only is your baby at risk, but you're at risk too. Not only can your baby die, but you can die as well. There can be many complications when you decide to use drugs while you're pregnant. One of the drugs that many women use, even while they're pregnant, is cocaine. Cocaine crosses through the placenta and enters the baby's circulation. Cocaine will remain in the baby's body much longer than it does in the woman's. During the early months of pregnancy, cocaine exposure may increase the risk of miscarriage. Later in pregnancy, cocaine can cause severe bleeding, preterm birth, and fatal death. Researchers also state that the risk of birth defects appears to be greater when the mother has used cocaine frequently during pregnancy. So the more cocaine the pregnant woman has done, the greater the risk for their baby. Babies born to mothers who use cocaine throughout their pregnancy may also have a smaller head and be growth restricted. Babies who are exposed to cocaine later in pregnancy may be born dependent and suffer from withdrawal symptoms such as tremors, sleeplessness, muscle spasms, and feeding difficulties. Learning difficulties may result as the child gets older. Defects of the genitals, kidneys, and brain are also possible. Another drug that is very common that people use to include pregnant women is methamphetamine, also known as meth, and it causes the heart rate of the mother and the baby to increase. The side effects, the problems, they're all similar to those seen with the use of cocaine while pregnant. The use of meth can increase the likelihood of premature labor, miscarriage, and placental abruption. Babies can be born addicted to meth and suffer withdrawal symptoms to include tremors, sleeplessness, muscle spasms, and feeding difficulties. Again, some of these same problems that the babies will suffer from methamphetamine are the same that they're suffering from cocaine. So not one drug is safer than the other. It's all the same. Learning difficulties may result as the child gets older as well. Heroin, this is another drug, can cross from the placenta to the baby. The drug is so addictive that the unborn baby can become dependent on the drug. Using heroin during pregnancy increases the chance of premature birth, low birth weight, breathing difficulties, low blood sugar, bleeding within the brain, and infant death. Babies can also be born addicted to heroin and suffer withdrawal symptoms, and this again includes irritability, convulsions, diarrhea, fever, sleep abnormalities, and joint stiffness. Okay, here's another touchy subject. Another common drug is marijuana. A lot of people think that there is nothing wrong with marijuana, that it's a safe drug, that it's not hardcore, that nothing can happen to their babies while they're in the womb while they smoke. I have known a lot of people that have chosen to smoke marijuana while they're pregnant, and their excuse is, well, it calms my anxiety down. It's not going to do anything to the baby. The doctor says it's okay. To me, these are just excuses. Anything that you're consuming that is iffy, you should think twice before doing, because is it really worth it? Marijuana is much like cigarette smoke, in which it contains toxins to keep the baby from getting the proper supply of oxygen that he or she needs to grow. Studies of marijuana are inconclusive because many people who smoke marijuana, are also using tobacco and alcohol. So the study is inconclusive because we're not sure. Researchers are not sure. Is it the marijuana, or hey, is it the tobacco and alcohol? Is it all of it together? We just don't know. It's still, smoking marijuana is not worth the risk. Smoking marijuana during pregnancy can increase the chance of miscarriage, low birth weight, premature births, developmental delays, and behavioral problems and learning problems. There are other kind of drugs that can be dangerous. Non-illegal drugs like over-the-counter and prescription drugs you have to be careful with. Pregnant women need to monitor the amount they're taking and exactly what they're taking. The FDA actually has guidelines for drug companies to follow in labeling medications about the effect on pregnancy and the growing fetus. All you have to do is read a bottle. There's warning signs. Do not take while pregnant. Consult with your doctor before you consume. These need to be taken seriously. All it takes is for a second to read the label and to make that decision. Hey, I'm not going to take this. It can affect my unborn child. There are a lot of medications that people take that they need while they're pregnant, such as people that are suffering from depression or asthma. Again, this is something that you should see your doctor with. Don't take it upon your hands to say, hey, it's okay for me to take this. A doctor would tell you exactly what you can take. Whether people know it or not, caffeine is considered a drug. Caffeine is legal and found in foods such as chocolate and soda. It should be limited while you're pregnant. Caffeine use has had toxic results in studies of rats. So what does that tell you? If it's toxic in rats, it's toxic in us. Pregnant women who need caffeine should regulate it. It can cause low birth weight and irritability if taken in large quantities. My first pregnancy, I didn't drink any soda. I took everything really, really serious. Now, in my second pregnancy, I would admit I did have a few caffeine drinks, and I did think, am I hurting my child from the caffeine? You definitely need to think about, should I drink this Mountain Dew, or should I have some water or some grape juice instead? It's something that can possibly cause an effect on your unborn baby. Alcohol and tobacco may not necessarily be considered drugs, but they are dangerous to consume while pregnant, like over-the-counter drugs and caffeine. The consumption of alcohol while pregnant can cause fetal alcohol syndrome. Children with fetal alcohol syndrome may also have learning disabilities, attention span disorders, and other physical disabilities, including vision and hearing problems. There is no safe amount of alcohol consumption during pregnancy. You'll have so many people say, oh, you can have a glass of wine while you're pregnant. It's not going to do anything. It's actually good for the baby. There's no evidence to sit there and say that it is safe to use, even in small moderation, alcohol. I would say no, don't use it at all. You don't know. You don't want to take that risk. You could be that one person that had a few glasses of wine and something's wrong with your baby, and then you have to blame yourself for the rest of your life that you had that glass of wine. You have some doctors that will tell you it's okay to have some wine while pregnant, and then you have others that say no, don't consume any amounts of alcohol. I've heard it all. I just wouldn't do it. It's not safe. Cigarette smoking causes serious illnesses and premature death in the world, but pregnant women who smoke pass the nicotine and other chemicals to the growing fetus. Mothers who smoke early in pregnancy are more likely to deliver babies to have several different heart defects. They can have a hole in the wall. Some have heart failure. Again, smoking cigarettes falls in another category like marijuana. Some people think it's okay to smoke cigarettes, that it doesn't do anything to the baby. But you're taking a risk. It's got chemicals. It's not healthy when you're not pregnant, so why would it be healthy while you are pregnant? It's just another one of those things you need to think twice before doing. Pregnant women should not smoke. They're more likely to have placenta problems. The placenta is what provides the nourishment to the baby. And you don't want to have any problems with your placenta not being able to deliver the proper nutrients to your baby. Your baby needs those nutrients to grow and to develop. Pregnant women who use tobacco have low birth weights, premature deliveries, and babies with cleft palates. It is also related to or associated with sudden infant death syndrome, also known as SIDS. That's a devastating thing to go through. Sudden infant death syndrome is when a baby who appears to be healthy dies during his or her sleep. You'll lay your baby down and go back to check on him or her, and he'll be dead. And I mean, it can happen. SIDS can happen when you're doing everything right for your baby, when you're following every protocol possible, but you do take a risk of that happening to your baby if you smoked a lot. It's rare, but it does happen. Women should just not use drugs during pregnant. If you use these illegal drugs such as cocaine, heroin, or marijuana, or you're using prescription or over-the-counter drugs that you should not be using, the consequences could be deathly. I mean, it includes heart attacks, respiratory failure, strokes, and seizures. There's so many different side effects. It can affect the development of the baby's central nervous system. Also, another thing to speak upon is breast milk. The same rules you have while you're pregnant tend to follow you after your baby is born if you want to breastfeed. A lot of drugs and even alcohol goes through the milk and into the baby. So you need to be careful with what you consume even after your baby is born if you want to breastfeed. I chose to write about this subject because it's something that hits home for me. My dad is a recovering crack addict. Drugs have been in my family. I'm thankful to say that there's no babies that have been born crack babies or drug babies, but it's something that's common in this world and that it does happen, and it's very sad because a baby is innocent. They have no say in what goes on or their health. It is our job to take care of them the best that we can, and if we shouldn't fail them. Deciding to get pregnant is a life-changing decision, and we need to do whatever we can to make sure that we take care of them and that they're happy and healthy. It's an innocent life that is in our hands, and it's just a blessing. So that's why I decided to write about that. And there's a lot of people that decide to do drugs. Drugs while you're pregnant, or drugs period, can lead to things that you didn't ask for or things that you expected. I had a friend who dabbled in drugs here and there, just wasn't living a healthy lifestyle, and she ended up getting HIV. So this is a little off topic, but not only does consuming drugs affect a pregnant person, but it just affects anybody. It's just stuff that is associated with drugs that you would never wish for anyone to go through. And my prop for this was actually my baby. I was gonna say, if you have a healthy pregnancy and do everything that you're supposed to be doing, you can have a healthy baby, even one who is a bit fussy. And that is all. Thank you.